Excuse me. Let's try. Get this. Okay, that's more better. Okay. I guess it was 2 weeks ago that I did the last follow-up, right?
Yeah, about 2 weeks ago, yeah.
Yeah, okay.
And then you got all sicky and stuff.
Are you on?
Mm-hmm.
Oh, okay. Yeah. Hi. Hi, everybody. Yeah, it's been a couple weeks. A rough couple weeks around here. I had my mastectomy on the 17th. And I believe David posted pictures from that, right?
Oh, I posted what we had, yeah.
Yeah, pictures from that. Okay. And, I've gotten other pictures since then, but they're kind of gross. And by that I mean I have no problem showing you. But I got a horrible infection that put me in bed all weekend last weekend with fever, chills, and honestly, I could not get out of the bed. So by Monday morning, my girl came. I got home health coming in the morning to change my bandage.
Yeah.
Okay. So in the morning, I got somebody coming to change my bandage. But over the weekend, because she didn't come during that time, per doctor's orders, this had all festered and pussed up, and it was horrid. And the skin turned black, meaning it was necrotic, which means it was dead. And had huge pus swells. And so, of course, I got in first thing Monday morning to my surgeon, not Monday. I called to set the appointment. I think I'd made it through the fever and chills. I did not leave bed. It was like the worst flu you've ever had. I do not remember the weekend. But Monday I called and they're like, get in first thing tomorrow morning. So I did go. And again, the doctor looked, and I can show you from outside the bandage anyway. Here it is, and it goes from here over to here. And then I have a drain that comes out here into a pod. But all over on this end was all black, and I mean this black. It was necrotic and dead. And over here on the top area, it was all pus and horrid. So my doctor, we were at her office, and she said, I want you to go home and pack a bag and go check into the hospital. I will see you in the morning for surgery. And I'm calling over there now to let them know you're coming. So that's what I did this past Tuesday. Left her office, came home, packed a bag, called David to let him know what was going on. And I went and I checked in. And, I had to check in through emergency, which is the quickest way to get tests done. Just to let you know, that's why she said do that. Because, of course, before I go into surgery, I have to have a COVID test. And I have to have a chest x-ray. And I have to have blood work done. And I have to give a urine specimen. So I had to do all those things before she could operate on me the next morning. And then Broward Health North is the hospital. The cancer center's attached to it. My doctors are amazing. Amazing doctors. I have two surgeons. One is my oncology surgeon, and my other one is the reconstructive surgeon. And since she was the last one to sew me up in the original surgery, she's the one who performed what they call debriding, cutting off all the dead flesh and cleaning everything out. My oncology surgeon, because they work always together, also was there to look in to see if he could find anything that had caused this. And the good news is, the answer to that is no. It was just an infection. It just happens when you have an incision that has to be closed up. But the good news was, because they were very concerned, I had told you before, I have, see, under my arm.
I don't know if we can see that, but...
You can't really see it, but I have lumps over here. But they went all the way back in under my arm because...
Well, I'm just looking at that from the last time I saw that. It's the swelling on that has gone down. So that's good.
Thing is, they have to take lymph nodes from me because they were cancer-filled. And the cancer lymph nodes, 7 of them were taken off my breast when they cut my breast off. 5 of them were taken from my armpit area. And then since the operation, I've been having trouble with the arm, and I think I've mentioned it, a bit of swelling and everything. And just to be safe, my surgeon went in, that was a move. Oncology surgeon was there just to make sure there was no cancer, no nothing. Because the pathology report came back very bad from my original surgery. And I was still, everything they pulled out after all the chemo I've had, 5 months of chemo, and everything, the cancer tumors should have been dead. The cancer in the lymph nodes should have been dead. And they pulled it all out, and of course they tested it all. And everything still had live cancer in it. So I'm not sure what that is going to bring for the future. But I am on a cancer it's called hormone therapy. And I will be on that for at least 10 years. And as a result of all this, I have to have home health care in here every day because they hooked up my port again, and this is just tape over here. Wait a minute.
No, don't pull the tape off.
See, that's the port. This is just the tubing. We just tape it up until it's time to... That's my port. You've never seen it hooked up that close. There you go. So, and anyway, so I have to have what's it called? Antibiotics, day and night, every morning and every night, for at least 2 weeks, at least, and then they'll do more blood cultures and find out what's going on. If I can get rid of this yet. Hopefully that will suffice. David and I we screwed it up so badly last night. The home health care nurse, not my regular nurse who was coming in for my bandage, who I've gotten to know. She was taking care of me for 2 weeks. But the other one, she's the one who said, I'm looking at this, you call your doctor immediately. But she wasn't there because they had to sign me into home health care again. They sent out an administrative nurse who's going to do my first thing. She's supposed to teach me how to do it so I can do it for myself in the evening. I said, the only way I'm going to remember this, because the menopause is bad enough, ladies, with our with a little memory lapses, but add chemo on top of it and forget it. So I said to her, you gotta write this out because I'm still foggy-headed. I did spend 5 days in the hospital. And I said, so please write this down. So she wrote instructions, 1, 2, 3, 4, blue, 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 blue. Very specific. She read it to me and I said, oh, okay, well then that should be easy enough to do. Then she comes in, change my bandage, the whole 9, and then she leaves. My nurse comes in today, and I told her the chaos. David and I went through last.
Well, first of all, I couldn't read her handwriting.
The instructions she gave, I could show you the paper. I worked for doctors, and I worked for attorneys. Those were my 2 actual careers. I'm very good at reading people's chicken scratch and odd writing and figuring out what they said or what they mean. Not so much. Because I looked at it before the nurse had left. I said, I'm not sure what this is. She goes, oh, you'll figure it out as you go. Okay. Thank God for my nurse, Nurse Faye. She's amazing. And she comes in this morning and she's like, I don't know what this is. She looks at it, she goes, I can't even read this. She tosses it aside and she says, SASH. Saline, antibiotics, saline, heparin. It's that simple. And you can figure out the rest. She goes, you know how to do this. And she's showing me, and it was so simple. She goes, don't even worry about that with blue caps and green caps and clips. And she goes, I don't even know what she's talking about here. And it got the 2 of us so confused. And, because everything's got to be sterile. You got to put out a sterile place, sterile placemat for everything to go on. You got to pull it all out first. We couldn't figure out what to pull out. Then you got to glove up, and the gloves are too small for David. And I can't do this. You know what I mean? And, it was crazy. It was chaotic. But forget it. I can laugh at it now, but last night it was really... It really upset me. I mean, physically, emotionally, like, it's the cat, Roxy. Roxy. Yeah. So, she, but that's it was really scary last night, if I'm repeating
Well, all I'm
myself.
saying is, it's pretty bad when your normal nurse comes in and she looks at it and she goes, I don't know what the hell this shit is.
Yeah, exactly. I have no idea what this is. You're adults, you've got common sense. She's talking about tabs and clips, and you don't need that to clean everything. You know that. You just had an infection. You can't do anything without gloves, and everything's got to be sterilized before you touch it. Or it's got to be wiped down with alcohol swabs. That's it. She's like, I don't know what she's talking about. Clips and caps. So anyway.
Now, for your time in hospital, you did have one nurse that you absolutely adored.
Oh, yeah. I got very fortunate. I checked in Tuesday, and they ran all those tests and everything. First they started me off in the ER, then they got me up to a room. So the first overnight, I had a nurse and a, nursing assistant for a few hours. Then they changed to my overnight. The nurse was great. The nursing assistant, horrible. Because I've had lymph nodes taken out of my armpit, my left arm can never again have a blood pressure cuff on it or have blood drawn from it. I did not know this. But I still had bandages. I was going in for surgery. You wouldn't touch that side anyway. I even let them draw blood for me in the ER because they had to get so much. They had to go from some off my left and some because I didn't know. I knew about the cuff. That's obvious. But I had no idea about the blood draw. Either way, I'm telling the girl you cannot put that blood pressure cuff on me. She's telling me to shush. She puts it on and causes me so much pain. I screamed out loud. And I just sat there. I was in so much pain I couldn't speak. When I caught my breath, she's there looking at me like I'm just this old white piece of trash there. And she's like, you don't know what you're talking about. And I said, it's my body. I'm the patient. You don't have a right to touch me if I say so. And everybody has that right. And I said, and you asked me a question, which side? I told you, and you thought it was more convenient over there. And you hurt me, and you harmed me, and you could have caused me grave damage. I'd like my nurse now, and I don't ever wish to have you in my room again. So my nurse comes in, and, of course, nobody can just jump on you. There's a whole floor, people. When she did come in, I told her, and I said, look here, I told her, she's like, I am so sorry, I am so sorry. She went out and put a band on, a pink band, which means restricted extremity. She's like, we should not have to do this. I am so sorry that happened to you. Everybody knows walking in here what you're being treated for. And, you're going in for an operation in the morning, and I said, it doesn't really matter. So what ended up happening, because of course they had to start IV and medication that's in my right arm on Tuesday, so that by Wednesday I had at least 12 hours antibiotics in my system. So the whole time in the hospital they were taking my blood pressure on my ankle. So that's the way that went. But in case it happened to anybody else out there that has had this done and was not informed, I had no idea. I truly didn't. I was told by the nurse, this is the way it is now. Nurse Faye told me that about the blood pressure. Don't ever let anybody put a blood pressure cuff on that arm ever again. Okay.
But you had one really fabulous nurse.
But after that was the first night. The next day I got assigned a nurse, and I had her until I left every day. Because nurses work 12-hour shifts from 7A to 7P, and from 7P to 7A, and that's the shifts. Don't ever expect to see anybody on any regular schedule between 7 and 8, because that's when they're finding out about how their patients are. But after that, and of course if it's an emergency, just ask, they get you. But I had this wonderful girl named Ayat, and she was so hysterical. I don't know why, but she loved me. And she was like, I just love you. You are my favorite. And I'm like, from the get-go, she loved me. I don't know what I did. Oh, another silly thing. The nurses put me on fall precaution. Well, first off, they've got me in isolation, so I have my own private room. Everybody who comes in the room is supposed to wear gowns and all like that and everything. Mask up, glove up, and the gowns. And she did do that first morning. But after the operation was done, and I'm lying there back in my room, she's like, how you doing? And I'm like, meh. Whenever it was that I came to or whatever, I'm not sure. And you're loopy for a little bit. But she's like, how you doing? And I said, well, I got to pee. And she's like, can you get up? And I'm like, with a little assistance. So she helped me. I got to the bathroom. I did my thing. Come back out. And I think it was during that hour of shift change that evening some other nurse had come in to check on me, saying, I'm going to be your nurse this evening. I'm just checking on everybody, and I'll be back around. Okay, my overnight. And I get up to pee. I've got fluids and antibiotics going me 24/7. And my bed goes off with a siren. Now, this is a siren like somebody stealing a car, those sirens, in a room. Scared the hell out of me. I finally got to the bathroom, and then, because I'm already unplugged with my pole, I go walking down the hall with my pole, and I'm like, who has done this to me? Now, Ayada's still there giving her report, and she looks at me, and she's like, what happened? She's like, what happened? And I said, they've got a 20-pound bag, and of course this is an exaggeration. They had a 20-pound bag of saline on my pole, plus the medications, and they're sitting there and put me on a bed precaution with alarms if I get out of bed. I have to pee every 30 minutes because of this thing. You're going to tell me I have to sit there and pee the bed before somebody gets to me to take me to the bathroom? Because that's going to happen. I'm like, that's ridiculous. You only put somebody on bed precautions when you don't want them to leave the bed, which means they have a catheter. I'm like, are you people out of your mind? And she looks at me and she goes, I'll take care of this. She goes, go ahead, go to your room. I said, you sure? She's like, I got you. And I'm walking away and I hear her go, who did that? And I knew I loved her then. Because she knew what I was saying making sense. I'm not being high from, it just makes sense. You can't have fluids running into somebody's body without fluids coming out. You know, if you're not interested in the outtake, which they weren't on this, then they don't catheter you, which I wasn't, which means I have to get up in the bathroom. It was crazy. Food is good.
But now you're home.
My nurse was amazing.
Yeah.
And after the second, and then I started, because, you know, they give you all the pain pills and all the happiness, whatever that all is. And I wasn't on a button this time, which I don't push the button. I don't like that button. Makes me nauseous. But when I got into pain, she was right there. You know, are you all right? What do you need? And what was I saying? I forget. I'm sorry. I've been talking a long time.
Yeah. But you're home now.
But I'm home.
So
I'm home. Yeah. I begged him, please let me go home.
Well, one of the things too, I remember, you know, Dr. Stokes came in and gave you a little rundown, and she said it was all surface, nothing was deep, so that was good. So
the good news, both surgeons came in to see me. Of course, every day they peeked in on me. But the first day or two, they don't really talk much to you because they know you're a little oof. Still, at least for me, it takes me a day or two to get a little clear-headed from what they... and the first time I had painkiller, and I was like, Percocet's fine. You know, I didn't want anything bigger than that. Well, you know, they hand you a cup, you do this, you take it. David comes after work, and I'm sitting there like this. I said, I asked for painkiller, they gave me 2.
That's kind of the way you said it, like you were drunk, like you were drunk,
I was
you know?
drunk. I was sitting there, he goes, what are you doing? I'm zoning out. They gave me 2 pills. You know, so that was I'm going to have to say forgettable. I must have been very entertaining, but for me, forgettable, because I don't remember the evening. I do remember that moment that David was there and saying, you know, because I had asked, why do I feel this? Why am I feeling... Well, I gave you the Percocet, I gave you a couple, and I was 2 pills? Anyway, don't do this to me again. You know, kind of thing. I had you this. But, yeah, I hear you. But anyway. Yeah. Okay. So anyway, I'm home now. My hair's just itty bitty, starting to grow in.
Here, pull it off. Let's see if it'll show up.
Oh.
Or just we'll sit up.
No. Give me a second. I'll take it off. It's starting to grow. Oh, but David said it's all gray.
Well, you got gray, and but the dark is actually coming in pretty dark though. So, yeah.
So you've seen more of my head than I can. And you know, I'm a blonde. And, you know, at times a dark blonde, but I'm always blonde. But this, I have no idea. I'm like, you know, I go online and talk to my friends. Like, yeah, that can happen. Your hair's going to come in. If it was thick, it'll come in thin. If it was straight, it can come in wavy. If it was light, it'll come in dark. You never know. I was like, okay. All right. But, so here I am.
Pardon me for the smoker's cough.
Yeah. So here I am. And, I'm a hot mess, you think? But it's part of the process. What are you going to do? Pain in the ass part, you know, this bulb thing I've had since my first surgery. And so it's been a month now. In 2 days, 2 days.
Yeah.
It'll be a month. Because today is Pi Day, David reminded me. So it's 314. Everybody have a slice. Or do some math. Anyway, that's it. I just wanted to tell you, and I've talked too much, and
it's been a while, so you wanted to talk. I get it.
Well, it's not so much I wanted to talk, it's that I get confused, and then I start things over, and I'm sorry for that.
But, and everybody's going through that good. I get you, girl. I get you.
Again, thank you with the GoFundMe page. I need help. I'm applying everywhere for assistance.
Yeah. That's a process.
I'm not going to get into the politics of it, but for some reason I'm hitting walls. I'm trying.
Yeah.
I'm trying.
Now,
but in the meantime, thank you so much. You're really helping me get through with bills. And I'm not even talking hospital bills. I can't even consider those bills anymore. But just even paying to have my insurance continue and you know, things like supplies I need in the house for this and everything that the.
Yeah. Now before you say goodbye,
okay.
You are under one rule about when you go out, when you have pain, go out.
Oh yeah, my new rule. He wanted me to turn, you know, pain into a funny. We try to laugh about things, you know. And whenever I hurt, I go, ow. And he said, I'm no longer allowed to say ow except like Batman. So, ow. It makes you laugh and it kind of subsides. So, that's it.
All right, well.
I'm going in for more tests next week, so I haven't bothered with any of my jewelry. Well, this is me, as about as naked as I've ever been.
And all your friends going, we've seen you much nakeder than this, but...
This makes me feel naked, though. Without clothing.
But you know, there's going to be that one dude that's going to hear that, and he's going to type some dumbass comment.
Without clothing has never been naked or shameful or uncomfortable for me. But this lack of hair and lack of jewelry and no nails and I've gained weight through all of this sitting because I have no immune system. I can't leave the house. But it's going to pass. Take a little while. I still got a lot to do. Next week I go in to talk to radiation. Hopefully by next month I'll be able to start it somewhere. And we're still moving forward. But I love you. And I thank you. I thank you. And so that means St. Patty's Day is coming this week. And for all of you who are able or going to celebrate, please be safe and be careful. But have a blast. Good night, everyone.